Hi, I'm Jared Phillips and I'm discussing Jehovah's Witnesses and blood transfusions, a bioethical issue. Articles such as this from the Washington Post in 2015 entitled "Why Doctors Let a Jehovah's Witness and Her Unborn Baby Die" raise lots of emotions in the readers. But more than that, it raises lots of questions. How did this occur? And why did this occur? We'll be looking at some of the bioethical principles that contribute to these scenarios throughout today's presentation. Jehovah's Witnesses refuse to accept blood transfusions. It's important to note that this is a religious decision based on scriptural interpretation. This is not a medical decision. As we delve further and understand the relationship between clinicians and Jehovah's Witnesses, it's important just to remember throughout our discussions that this is a decision based on faith. So what are the bioethical principles that we're looking at? Firstly, autonomy. Can the Jehovah's Witness patient exercise autonomy over decisions affecting their health care? Secondly, beneficence. Can the clinician provide appropriate treatment that will promote good health? And thirdly, non-maleficence. Can the clinician minimize or not inflict harm? Beauchamp and Childress discuss three key conditions that contribute to autonomy. In the setting of the Jehovah's Witness patients and blood transfusions, the patient needs to understand what the procedure is. They need to understand the potential risk that will occur if the procedure, the blood transfusion, does not proceed. They need to be intentional. They need to be direct with the directive and the instructions that they give the clinical team. And thirdly, they need to be free from external controls. And in our situation, that's referring to being free from influence from the church or free from influence from family or community members. Beauchamp and Childress also discuss in great detail informed consent, and they list 5 key conditions that contribute to ensuring that informed consent is achieved. These are competence, disclosure, understanding, voluntariness, and consent. I'm just going to focus on competence for a moment. Savulescu and Momea in 2012 discussed that Jehovah's Witnesses might hold views and beliefs that are not held by the majority of members of society, including the majority of the medical profession. They do comment that although the Jehovah's Witnesses might be in the minority, this doesn't mean that they're irrational, and therefore this doesn't bring the competency of the patient into question. The competency of a patient needs to be assessed in the same way that competency of any patient would be assessed by a treating clinician. Jehovah's Witnesses are quite proactive in demonstrating their informed consent. They usually carry an advance directive card that specifically refuses medical treatment, and in their situation it's refusing blood transfusions. They carry this documentation on their person so that in the instance that they were involved in an accident and they have to present at an emergency department, even though they might be unable to verbally provide informed consent, they will have written informed consent detailing their refusal for blood transfusions or any other said procedure. The Australian Medical Association has a code of ethics to guide doctors in situations such as these. Section 2.1.1 does state, firstly, to consider the well-being of the patient. This reflects their beneficence and the general approach of the medical profession to be able to do good for the patient and assist them. However, 2.15 and 2.16 clearly stress the importance that the AMA places on patient autonomy. It details the doctor should respect the patient's right to make their own healthcare decisions, the right to accept or reject treatment procedures, including life-sustaining treatments, and also to respect the patient's right to refuse consent. And in our case, that does refer to refusing consent for blood transfusions. Just going to have a look at a couple of practical scenarios that have occurred and been reported in the mainstream media throughout Australia and internationally. The cases that we're looking at have occurred in Sydney, in London and in Washington, and the key things to note are that in each of these situations there has been a Jehovah's Witness in hospital who has been able to provide informed consent, a competent patient providing informed consent, refusing blood transfusion, and subsequently they died as a result of all of these actions. These can cause quite a lot of distress through to the treating clinical team, and this is part of the one case that I'm going to have a look at now. Specifically, this is a situation discussing a 28-year-old pregnant female who was also subsequently diagnosed with leukemia, presenting at the Prince of Wales Hospital in Sydney 2015. Medical consensus recommended administering blood transfusion. However, the patient had an advanced care directive refusing transfusion. As a result, chemotherapy was deemed unsafe due to the pending birth and the lack of transfusion. Subsequently, fetal death occurred. The patient suffered significant clinical impact, multi-organ failure, and treatment was withdrawn, and she died shortly after. The authors of the paper, who were haematologists from the pathology department at the Prince of Wales, reported that the clinical staff noted significant levels of distress and not being able to perform their task in reducing harm, preventing death, ultimately being unable to exercise beneficence or non-maleficence. However, despite this, the fundamental moral principle of patient autonomy was respected. This reflects the broad legal and ethical consensus that competent adults may refuse any form of medical intervention, even where that intervention is life-saving. This bioethical issue of Jehovah's Witnesses and blood transfusions has made its way into the legal framework within Australia. The two cases we see on the screen at the moment, occurring in Adelaide 2012 and Brisbane 2015, both refer to cases of Jehovah's Witness families where a child, a minor, has been hospitalised with a life-threatening condition. The hospital has recommended blood transfusions as a life-saving treatment. Parents have refused. The hospital has subsequently taken the family to court to obtain a court approval to perform the transfusion, and succeeded in both of these scenarios. So this obviously adds another dimension to the relationship between the autonomy and informed consent when it comes into the play with minors. So where does this leave us? The principle of autonomy is a critical component of administering healthcare. Informed consent by competent Jehovah's Witnesses underpins their right to refuse blood transfusions. Healthcare professionals do need to respect the autonomous requests by competent Jehovah's Witnesses, even if there are conflicts of belief. The ability to exercise beneficence and non-maleficence must not override the principle of autonomy. However, the application of these principles for Jehovah's Witnesses who are unable to provide informed consent or who are minors is still a contentious and ill-defined issue assessed on a case-by-case basis. In Australia, that does mean going to court in certain times. Thank you very much.